Imagine trying to breathe through a tiny straw, every single breath a desperate struggle for air. For millions worldwide, this isn't just a thought experiment, it's the terrifying reality of an asthma attack. This chronic respiratory condition affects people of all ages, turning the simple act of breathing into a battle. But what exactly is asthma? What causes these life-altering episodes, and perhaps most importantly, how can we effectively manage it to live full, active lives? In this extensive deep dive, we'll unravel the mysteries of asthma, from the microscopic changes within your airways to the strategies that empower patients to reclaim their breath. At its core, asthma is a chronic inflammatory disease of the airways. It's not just a momentary shortness of breath, it's a persistent state where your bronchial tubes, the passages that carry air to and from your lungs, become hypersensitive and inflamed. This inflammation leads to a cascade of events, making the airways prone to narrowing. Think of your airways as flexible pipes. In asthma, these pipes are constantly irritated, making them swell and react excessively to various stimuli that wouldn't bother someone without the condition. This chronic aspect is crucial to understanding why asthma requires ongoing management. The hallmark features of asthma are airway hyperresponsiveness, reversible airflow obstruction, and inflammation. Airway hyperresponsiveness means your airways overreact to triggers, contracting more readily than normal. Reversible airflow obstruction refers to the narrowing of the airways, which can be improved with medication. And the underlying inflammation is the constant low-level irritation that primes the airways for these reactions. These three elements work in concert, creating the characteristic symptoms of asthma. It's a complex interplay, making asthma a challenging condition to manage without a clear understanding of these fundamental principles. Let's zoom into the microscopic level to truly grasp the pathophysiology. The inner lining of your airways, called the epithelium, is constantly exposed to the outside world. In asthmatic individuals, this epithelium often shows signs of damage. Beneath it, there's an infiltration of various inflammatory cells, primarily eosinophils, mast cells, T lymphocytes, and macrophages. These cells release a cocktail of chemical mediators, cytokines, leukotrienes, and histamines, which perpetuate the inflammatory cycle. This cellular battleground leads to the swelling and irritation that characterize asthmatic airways, making them exquisitely sensitive to even minor irritants. One of the most significant changes is the remodeling of the airway walls. Over time, chronic inflammation can lead to structural alterations. The smooth muscles surrounding the bronchi can thicken, making the airways more prone to spasms and narrowing. There can also be an increase in mucus-producing glands, leading to excessive mucus production which further obstructs the airways. This process, known as airway remodeling, contributes to the progressive and sometimes irreversible nature of severe asthma. Understanding this remodeling highlights the importance of early and consistent treatment to prevent long-term damage. During an asthma attack, several things happen simultaneously. First, the smooth muscles surrounding the bronchi contract rapidly. This is bronchoconstriction, the immediate tightening of the airways. Second, the already inflamed lining of the airways swells even further. Third, mucus glands produce thick, sticky mucus, which can form plugs, further blocking the airflow. All these factors combined drastically reduce the space available for air to pass through, leading to the classic symptoms of wheezing, coughing, chest tightness, and severe shortness of breath. It's a sudden, terrifying event that can quickly escalate. Now that we understand the what and how, let's explore the why. What triggers these reactions? Asthma triggers are diverse and highly individual. What affects one person might not bother another. They can be broadly categorized into allergens, irritants, exercise, infections, and even certain medications. Identifying your specific triggers is a cornerstone of effective asthma management. It's like being a detective, carefully observing your environment and body's reactions to pinpoint the culprits that provoke your symptoms. This personalized approach is vital for prevention. Allergens are perhaps the most common triggers, especially in allergic asthma. These are substances that cause an allergic reaction. Common culprits include pollen from trees, grasses, and weeds, dust mites found in bedding and carpets, pet dander from cats and dogs, and molds. When an asthmatic person is exposed to these allergens, their immune system overreacts, launching an inflammatory response in the airways. This hypersensitivity to otherwise harmless substances is a key feature of allergic asthma, often running in families with a history of allergies, eczema, or hay fever. Environmental irritants, unlike allergens, don't necessarily cause an allergic reaction but directly irritate the airways. These include tobacco smoke, both active and passive, air pollution from traffic and industrial sources, strong chemical fumes from cleaning products or paints, and even very cold or dry air. These substances can directly damage the airway lining or stimulate nerve endings, leading to bronchoconstriction and inflammation. Avoiding these irritants is often a crucial step in preventing asthma exacerbations, as their presence can significantly worsen airway sensitivity. Exercise-induced bronchoconstriction, or EIB, is another common trigger. For some individuals, vigorous physical activity, especially in cold or dry air, can lead to narrowing of the airways. This isn't necessarily a sign of poorly controlled asthma but a specific type of trigger. It's thought to occur because rapid breathing during exercise causes the airways to dry and cool, leading to irritation and constriction. However, EIB shouldn't prevent individuals from exercising. Proper warm-ups and pre-exercise medication can often allow people to participate in sports safely and comfortably. Respiratory infections, such as the common cold, flu, or bronchitis, are frequent triggers for asthma exacerbations. Viruses and bacteria can further inflame the already sensitive airways, making them more reactive and prone to narrowing. What might be a mild cold for one person can quickly turn into a severe asthma attack for another. This is why vaccination against the flu and pneumonia, and practicing good hand hygiene, are particularly important for people with asthma. Preventing infections is a key strategy for maintaining stable asthma control. Certain medications can also trigger asthma symptoms in sensitive individuals. Nonsteroidal anti-inflammatory drugs, NSAIDs, like aspirin and ibuprofen, and beta blockers, commonly used for heart conditions or high blood pressure, are known culprits. Aspirin-exacerbated respiratory disease, AERD, is a specific syndrome where aspirin or NSAIDs can trigger severe asthma attacks, often accompanied by nasal polyps. It's crucial for asthmatic patients to always inform their doctor about their condition before starting any new medication, ensuring potential drug interactions or triggers are identified and avoided. Other less common but significant triggers include strong emotions like stress, anxiety, or even laughter. Gastroesophageal reflux disease, GERD, where stomach acid flows back into the esophagus, can also exacerbate asthma symptoms, particularly at night. Hormonal fluctuations in women, especially during menstruation or pregnancy, can sometimes influence asthma severity. It's clear that asthma is a multifaceted condition, influenced by a wide array of internal and external factors. This complexity underscores the need for comprehensive and individualized management plans. Given the chronic nature and diverse triggers of asthma, effective management is paramount. The goal of asthma management is twofold: to achieve good control of symptoms, allowing for normal activity and sleep, and to prevent future attacks or exacerbations. This often involves a combination of medication, trigger avoidance, and a personalized action plan. It's not about curing asthma, as there is currently no cure, but about living well with the condition and minimizing its impact on daily life. Regular monitoring and communication with healthcare providers are key. Medications form the cornerstone of asthma treatment. They are generally divided into two main categories: quick relief, or rescue, medications and long-term control, or controller, medications. Quick relief medications work rapidly to alleviate symptoms during an attack, while long-term control medications are taken daily to prevent symptoms and reduce inflammation. Understanding the difference between these two types is vital for effective and safe asthma management. Misusing quick relief inhalers can indicate poor asthma control and the need for adjustment in the long-term therapy. Short-acting beta agonists, SABAs, are the primary quick relief medications. These include drugs like albuterol or salbutamol. SABAs work by relaxing the smooth muscles around the airways, causing them to open up rapidly, usually within minutes. They are used on demand for sudden asthma symptoms or before exercise to prevent EIB. While incredibly effective for immediate relief, SABAs do not address the underlying inflammation. Over-reliance on SABAs, meaning using them more than twice a week, excluding pre-exercise use, often signals that long-term control is inadequate and needs review. Long-term control medications are the daily workhorses of asthma management. Inhaled corticosteroids, ICS, are the most effective anti-inflammatory medications available for asthma. These include fluticasone, budesonide, and mometasone. ICS work by reducing inflammation and swelling in the airways, making them less sensitive and less prone to attacks. They don't provide immediate relief but build up their effect over days or weeks. Consistent daily use, even when feeling well, is crucial to prevent symptoms and reduce the risk of severe exacerbations. Adherence is key for optimal outcomes. Other long-term control medications include long-acting beta-agonists, LABAs, and leukotriene modifiers. LABAs, such as salmeterol or formoterol, also relax airway smooth muscles but have a longer duration of action compared to SABAs. However, LABAs are never used alone in asthma. They are always prescribed in combination with an ICS to prevent the risk of severe asthma-related events. Leukotriene modifiers, like montelukast, block the action of leukotrienes, which are inflammatory chemicals. These oral medications can be particularly helpful for allergic asthma or exercise-induced asthma, offering an alternative or add-on therapy. For severe asthma that isn't well controlled with standard ICS/LABA therapy, advanced treatments known as biologics have revolutionized management. These injectable medications target specific inflammatory pathways. For example, omalizumab targets IgA, an antibody involved in allergic reactions. Mepolizumab, rislizumab, and benralizumab target eosinophils, a type of white blood cell prominent in allergic and eosinophilic asthma. Dupilumab targets both IL-4 and IL-13, cytokines involved in type 2 inflammation. Biologics offer hope for those with refractory asthma, significantly reducing exacerbations and improving quality of life, but are carefully selected based on the patient's specific inflammatory profile. Oral corticosteroids, such as prednisone, are powerful anti-inflammatory drugs reserved for short-term use during severe asthma exacerbations. They can quickly reduce inflammation and help regain control of symptoms. However, due to significant potential side effects like bone thinning, weight gain, and increased risk of infection, they are generally avoided for long-term daily use. When prescribed, the goal is to use the lowest effective dose for the shortest possible duration. Their role is primarily to reset the airways during an acute flare-up, not for routine maintenance. Another crucial aspect of management is developing a personalized asthma action plan. This is a written document created with your doctor that outlines your daily treatment, how to recognize worsening asthma, and what steps to take during an exacerbation. It typically uses a traffic light system: green zone, controlled asthma; yellow zone, worsening symptoms, action needed; and red zone, medical alert, emergency care needed. An action plan empowers patients to take control, guiding them on when to increase medication, call their doctor, or seek emergency help, often preventing severe attacks. Trigger avoidance is equally important. Once you've identified your specific triggers, taking steps to minimize exposure can significantly reduce symptoms and the need for rescue medication. This might involve using allergen-proof bedding, regularly cleaning to reduce dust mites, keeping pets out of the bedroom, avoiding areas with high air pollution, or wearing a scarf over your mouth and nose in cold weather. It's about creating an environment that supports healthy breathing and reduces the burden on your sensitive airways. Small changes can make a big difference. Proper inhaler technique is absolutely critical for medication effectiveness. Many patients do not use their inhalers correctly, meaning the medication doesn't reach the lungs where it needs to work. This can lead to uncontrolled symptoms despite being on appropriate medication. Healthcare providers should regularly review and demonstrate correct technique, often using a spacer device for metered dose inhalers to ensure optimal delivery. Even a slight error in technique can drastically reduce the amount of drug reaching the airways, rendering the treatment ineffective. Practice makes perfect when it comes to inhaler use. Regular monitoring of lung function can also be a valuable tool. A peak flow meter is a portable device that measures how fast you can blow air out of your lungs. Daily measurements can help identify narrowing of the airways even before symptoms appear, allowing for early intervention according to your action plan. For more detailed assessment, spirometry tests performed in a clinic measure various lung volumes and airflow rates, providing a comprehensive picture of lung health and confirming the diagnosis of asthma. These tools help track the effectiveness of treatment and guide adjustments. Living with asthma also means recognizing the signs of an impending or worsening attack. These can include increased coughing, wheezing, shortness of breath, chest tightness, or a drop in peak flow readings. It's important to differentiate between mild, moderate, and severe symptoms, as the required action will vary. Early recognition and prompt action, guided by your asthma action plan, are essential to prevent a mild exacerbation from escalating into a life-threatening emergency. Don't ignore subtle changes, your body is giving you important signals. When should you seek emergency care? If your quick relief inhaler isn't working after several puffs, if you have severe shortness of breath that makes it hard to talk or walk, if your lips or fingernails turn bluish, or if you experience confusion or drowsiness, it's a medical emergency. Don't hesitate to call emergency services. These are signs of a severe asthma attack that requires immediate medical attention and professional intervention. Waiting can have dire consequences. Always err on the side of caution when breathing is severely compromised. Asthma can have significant psychological impacts. The constant worry about an attack, the limitations on physical activity, and the stigma associated with a chronic illness can lead to anxiety, depression, and social isolation. It's important to address these emotional aspects as part of a holistic management plan. Support groups, counseling, and open communication with healthcare providers and loved ones can provide much-needed emotional support. Mental well-being is intrinsically linked to physical health, especially in managing a chronic condition like asthma. The role of genetics in asthma is well established. If one or both parents have asthma or allergies, the likelihood of their child developing asthma significantly increases. However, genetics alone don't tell the whole story. Environmental factors play a crucial role, interacting with genetic predispositions. This interplay between nature and nurture is complex, making asthma a multifactorial disease. Researchers are continually exploring specific gene variations that increase susceptibility, aiming to develop more targeted therapies in the future. The hygiene hypothesis is an intriguing theory that attempts to explain the rising prevalence of asthma and allergies in developed countries. It proposes that reduced exposure to microbes and infections early in life, due to overly hygienic environments, may lead to an imbalance in the immune system. This imbalance could predispose individuals to develop allergic diseases like asthma. While still a hypothesis, it highlights the complex relationship between our immune system, environment, and the development of chronic conditions. Asthma management is an evolving field, with new research constantly emerging. From novel biologic therapies targeting even more specific inflammatory pathways to personalized medicine approaches based on an individual's genetic profile and inflammatory phenotype, the future holds promise for even more effective treatments. Research is also focusing on preventative strategies, especially in early childhood, to potentially alter the course of the disease or even prevent its onset. This ongoing scientific endeavor offers hope for improved outcomes for asthmatic patients worldwide. Diet and nutrition also play a supporting role in asthma management, though they are not a primary treatment. While there's no specific asthma diet, a balanced diet rich in fruits, vegetables, and omega-3 fatty acids may have anti-inflammatory benefits. Some individuals find certain food additives or sulfites can trigger symptoms, so avoiding these might be beneficial if a clear link is established. Maintaining a healthy weight is also important, as obesity can worsen asthma symptoms and make them harder to control. Lifestyle choices complement medical therapy. The impact of asthma on children can be profound. It's a leading cause of school absenteeism and can limit participation in sports and social activities, affecting their quality of life and development. Managing childhood asthma requires careful consideration of growth and development, as well as involving parents and caregivers in the treatment plan. Early diagnosis and consistent management are crucial to ensure children with asthma can lead active, healthy, and fulfilling lives, minimizing the long-term effects of the disease. Environmental policy and public health initiatives are also vital in the broader fight against asthma. Reducing air pollution from industrial sources and vehicle emissions, promoting smoke-free environments, and improving indoor air quality in homes and schools can have a significant impact on reducing asthma triggers and improving lung health for entire populations. These large-scale efforts complement individual management strategies, creating healthier environments for everyone, especially those with sensitive airways. Let's briefly touch upon the difference between asthma and COPD, as they are often confused. Chronic obstructive pulmonary disease, COPD, is also a chronic lung disease, but it typically involves irreversible airflow obstruction, primarily caused by long-term exposure to irritants like cigarette smoke. While some individuals can have features of both, asthma-COPD overlap syndrome, asthma is generally characterized by reversible airway obstruction and often starts in childhood. The underlying pathophysiology and management strategies, particularly the emphasis on inflammation reversibility, differ significantly. In summary, asthma is a complex, chronic inflammatory condition of the airways characterized by hyperresponsiveness and reversible airflow obstruction. Its triggers are diverse, ranging from allergens and irritants to exercise and infections. Effective management relies on a multi-pronged approach, identifying and avoiding triggers, consistent use of long-term control medications like inhaled corticosteroids, judicious use of quick-relief medications, a personalized asthma action plan, and regular monitoring of lung function. This comprehensive strategy empowers individuals to control their asthma, rather than letting asthma control them. Remember, living with asthma doesn't mean living a limited life. With the right knowledge, medication, and support, millions of people worldwide successfully manage their condition and pursue their passions. If you or someone you know struggles with asthma, prioritize open communication with healthcare professionals. Advocate for yourself, understand your body's signals, and be proactive in your management plan. Every breath is precious, and with proper care, you can ensure each one is as easy and full as possible. Breathe deep, live fully. Thank you for joining us on this in-depth journey into understanding asthma. We hope this video has provided valuable insights and empowered you with knowledge. If you found this information helpful, please like this video, subscribe to our channel for more health-related content, and share it with anyone who might benefit. Your support helps us create more educational resources. We welcome your questions and comments below. Let's continue the conversation and foster a community of understanding and support for those impacted by asthma.